The government has recognized the importance of nutrition for the healthy future of the children. To address the issue of malnutrition amongst children, the revamped midday meal program with additional nutritious food items in the menu in the name of Jagananna Goru Mudda is being implemented in the state for the children of classes 1 to 10, covering 43.26 lakh children. The amount incurred so far on this program by my government is rupees 3,239 crores. Realizing the importance, value attached globally for English in the modern times and to equip our students for 21st century skill demands, my government is actively working to provide quality English medium education to all and thereby fulfill the aspirations of the parents from poorer sections. Bilingual textbooks, English labs have been introduced to achieve this aim. My government has implemented several curricular reforms from the academic year 2020-21 with a greater focus on foundational learning and numeracy. The textbooks from classes 1 to 7 have been redesigned with greater focus on an activity-based curriculum. Affiliation of government schools to CBSE and the capacity building of teachers are some of the other key reforms initiated. Keeping in view of the affiliation of all government schools to CBSE, the textbooks for class 8 have been adopted from NCERT and customized with local content and printed in bilingual both in Telugu and English. To ensure that all the students passing out of high schools continue their education and don't drop out, my government has decided to establish at least 2 junior colleges per mandal across the state, out of which one shall be exclusively for girls. My government is giving utmost importance to higher education. Andhra Pradesh is the only state in the country to take complete responsibility for providing higher education to 100% of its eligible students free of cost without any financial burden on their families. The government has initiated path-breaking reforms to transform the youth of the state into enlightened and employable global citizens ready to tackle future global challenges. With a view to ensuring that higher education is accessible even to children of disadvantaged sections, my government is reimbursing total fees under Jagananna Vidya Dinena. Under the scheme, the amount is transferred directly on a quarterly basis into the accounts of such mothers whose children pursue ITI, polytechnic, degree, engineering, B Pharmacy and other courses. So far, rupees 9,249 crores have been reimbursed to 24.75 lakh beneficiaries. Through Jagananna Vasati Divena, we are providing allowance up to rupees 20,000 for hostel and mess charges. Under the scheme, amount is credited directly into the accounts of mothers whose children are pursuing higher education. So far, an amount of rupees 3,366 crores has been disbursed to 18.77 lakh students under the scheme. Effective implementation of equitable and inclusive schemes like Jagananna Vidya Divena and Jagananna Vasati Divena has resulted in significant improvements in gross enrollment ratio in Andhra Pradesh. The government has also established new higher educational institutions such as Tribal Engineering College at Kurupam, JNTU Gurajada at Vizianagaram, Andhra Kesari University at Ongole, Dr. YSR Architecture and Fine Arts University at YSR Kadapa, Cluster University at Kurnool, and 14 government degree colleges to provide accessible and inclusive higher education. For the first time in the country, my government has created a 50% government quota in medical dental courses and a 35% government quota in all other courses in private universities in the state. Meritorious poor students are provided admission to private universities following the rule of reservation. Good health and well-being, the key pillars of a healthy society. Dennis Waitley had said, and I quote, "Time and health are two precious assets that we don't recognize and appreciate until they have been depleted," unquote. Providing access to health facilities for all citizens and achieving universal health coverage is one of the key priorities of my government. My government is providing quality health care free of cost for all through Dr. YSR Arogya Shri scheme. The scheme covers about 1.41 crore families, and this constitutes nearly 95% of the state's population. The procedures covered under Dr. YSR Arogya Shri program have been increased from 2,446 to 3,255 from October 2022. The scheme coverage now extends outside the state to the cities of Hyderabad, Chennai, and Bangalore for 716 super specialty procedures in a significant move to help the citizens, especially the poor. COVID-19 treatment has been brought under Arogya Shri umbrella. 1.41 crore smart health cards with QR code are issued to the eligible beneficiaries under Dr. YSR Arogya Shri scheme. Furthermore, under Dr. YSR Arogya Asara scheme, a maximum of rupees 5,000 per month is provided as financial assistance to patients for the post-surgery care, recognizing the need to compensate for their lost working ability. So far, an amount of rupees 971.28 crores has been spent benefiting 15.65 lakh persons. As a result of effective implementation of mother and child care services in the state, there has been a phenomenal decline of 19% in the maternal mortality ratio, which has steeply declined to 45. The state stood fourth at the national level as per the latest SRS report, and the state has already achieved the SDG target of 70 per 1 lakh live births well before the timeline of the year 2030. Under the 5-child mortality rate too has witnessed a 13% decline and stood at 27% per 1,000 live births as per the latest SRS report, and inching towards the SDG target of 25 per 1,000 live births by 2030. My government has formulated the Family Physician Program intended to extend the healthcare services at the doorsteps of the community through the medical officers to deliver curative care in addition to prevention of diseases. Under this program, medical officers will visit Dr. YSR village health clinics twice in a month to deliver the priority medical services along with CHOs, ANMs, ASHAs, and other PHC staff. To achieve the objective under the family physician concept, 2 doctors are made available in all the PHCs on permanent recruitment, with 1 doctor attending the PHC and the other attending the YSR village health clinic through 104 MMU vehicles on fixed day schedule to provide the healthcare services. My government is committed to reducing the infant mortality rate by strengthening neonatal care services. To reduce the neonatal mortality, my government is undertaking expansion and strengthening of facilities like special newborn care units, MINI, tribal special newborn care units, nutritional rehabilitation centers. Leveraging technology, better health care access is being provided to the citizens in the state through Dr. YSR telemedicine. Total 2.83 crore teleconsultations have been done through telemedicine, which account for 35% of the total consultations in India, the highest done by any state in the country.